Well, a very good evening to you and welcome to RTV News with me, Fiona Mbabazi. We start with news just in. His Excellency, the President of the Republic of Rwanda and the Commander-in-Chief of the RDF has promoted and appointed the following RDF personnel as follows. Lieutenant Colonel J.P. Nyirubutuma is promoted to Colonel and appointed Deputy SG NISS in accordance to the new structure. I repeat, Lieutenant Colonel J.P. Nyirubutama is promoted to Colonel and appointed Deputy SG NISS in accordance to the new structure. Lieutenant Colonel Kalisa is promoted to Colonel. Lieutenant Colonel Francis Ngabo Sebi Chundanyi is promoted to Colonel. Lieutenant Colonel Ronald Rwivanga is promoted to Colonel. The promotions and appointment to take immediate effect. Now, with the increasing number of COVID patients across the country, preparations are now underway to reopen Kanyinya Health Center that had been closed since January 2021 to support other health facilities in treating COVID-19 patients. Gloria Mutesi visited some of the COVID treatment centers and filed the following report.
At about 3 p.m. here at the Nyarugenge COVID-19 Treatment Center, a patient has just been admitted from Muhima Hospital, unconscious, and his vitals are okay but in need of oxygen. Lately, with a spike of infections across the country, we are told by healthcare workers at this treatment center that such scenes are happening more often, with many patients being referred from other hospitals. During our visit to this treatment center, we visited the ICU where critically ill patients are being taken care of. All beds are full and almost all patients are being aided to breathe by ventilators. Nurses and doctors are seen pacing under their protective garments to ensure that patients are adequately taken care of. It's hot, it's loud, and the work never stops. Even in the most intense and scary moments, though, they don't forget to be compassionate. Away from the ICU, we visit some of the patients that are recovering who share their experience with us.
I was at home quarantine. Then unfortunately my oxygen level dropped slightly lesser. So what I had to do, my management decided to send me here. And here I got one of the best treatments. I was given proper medication and proper care. Based on that, I'm feeling better. Now my oxygen level has gone better.
The Nyarugenge Treatment Center has the capacity to receive about 130 patients. But currently, the Director General of the hospital says that in the recent days, the sheer volume of patients with COVID-19 they are receiving is overwhelming.
As we are having an increase of infection in our country, really it is the same in our hospital. We are in this week, 1 week only, we are having an increase from 20% to 83%. And among our patients, we are having 40% who are requiring oxygen.
With the severity of the pandemic now, the decision was made to reopen the Kanyinya Health Center to support Nyarugenge Treatment Center in treating COVID-19 patients. After almost 6 months since the Kanyinya Health Center shut its doors to COVID-19 patients, in the wake of the increase of infections across the country, the health center preparations are underway for the health center to be reopened to support the Nyarugenge Treatment Center that is almost full to capacity. While inspecting the preparations ahead of reopening, Dr. Cornel Nihabose, the head of clinical and public health services in the Ministry of Health, said they're increasing capacity of case management as the country experiences a spike in infections.
But within the Kigali, we've only Nyarugenge, which was operating since January up to now. There's a need to increase also another treatment center. The reason why we are reopening the Kanyinya Treatment Center by bringing again some equipment, some staff, some medical supplies to have a capacity also to start again to have some case management here at Kanyinya Treatment Center. In less than 24 hours, we may support Nyarugenge Hospital to have to receive the first patients, because at the pace we are, the Nyarugenge Treatment Center must have the full capacity, must have the full occupation. The reason why in less than 24 hours, this night or tomorrow, we may start receiving the first patients.
The World Health Organization emphasizes the need for stringent public health measures after Africa has now surpassed 5 million COVID-19 cases.
After 4 weeks of consecutive increases, Africa's third wave is surging upward and accelerating fast. New cases continent-wide are up by nearly 30% in the past week, and deaths are up by 15%. At the continental level, we're seeing a rise in cases similar to the first wave peak in July 2020, and about 50% of the second wave peak in January 2021. So Africa is in the midst of a full-blown third wave. The sobering trajectory of surging cases should rouse everyone to urgent action. We've seen in India and elsewhere how quickly COVID-19 can rebound and overwhelm health systems. Public health measures must be scaled up fast to find, test, isolate, and care for patients, and to quickly trace and isolate their contacts.
On Thursday, out of the 5,770 tests that were conducted in Rwanda, 422 people tested positive for coronavirus, the highest number of daily infections since the first case was identified in Rwanda. Reporting for RTV News, Gloria Mutesi.
Definitely a wake-up call there. Now, as the number of people infected with the COVID-19 continues to rise, some residents of Kigali City seem not to be adhering to the preventive measures. Now, the Ministry of Health has warned that not following these guidelines that have been put in place is giving a push to the rising numbers.
Various parts of Kigali City, people are reminded daily about the COVID-19 preventive measures through loudspeakers. Some of the residents say that the increase in the number of COVID-19 cases is scary. I heard the number of COVID-19 cases have mounted up to 400. This means that people should be more cautious. On one hand, there are still some people spotted in public areas of Kigali, such as markets and shops, not adhering to the COVID-19 preventive measures as they do not respect social distancing and not wearing face masks properly. Some of them gave reasons to why they do not adhere to the COVID-19 preventive measures in place. We are aware of the measures. It's just that sometimes it so happens that a person can remove the face mask by mistake. Among the instructions that have been given to shop owners in Kigali was to tie a rope at the shop door as a way to prevent people from entering the shop and to have hand-washing facilities at the doorstep in order to facilitate their clients to avoid acquiring the COVID-19 virus. Currently, most shops in Kigali have removed the ropes and customers are entering without first washing their hands as the washing facilities are also out of water. The issue of people not respecting the COVID-19 preventive measures is magnifying despite the efforts of youth volunteers in reminding people in public areas to adhere to the measures. It is not easy, but we try to remind people to wear their face masks properly and follow the other guidelines as well. The Minister of State in charge of primary health care, Dr. Mhunga Tassis, says something needs to be done, especially in Kigali, in order to reduce the number of COVID-19 cases. During the total lockdowns, life had changed, especially for many people in Kigali. As the number of cases had started to reduce, activities started resuming and things were starting to get back to normal. But now that they are increasing, this means that something has to be done both on an individual level and collectively. The existing preventive measures have been helpful so far. The latest figures released by the Ministry of Health on the 17th show that 422 people countrywide have been infected with the COVID-19 virus, with Kigali having the highest number of infected people. Jane Mutoni, reporting for RTV News.
Absolutely. I mean, I guess it's a wake-up call. Wash your hands, avoid crowds, wear your masks correctly, and let's try to flatten the curve. Now, nearly 600 students that attended Kigali Institute of Management University, KIM, have expressed concern over the delay on receiving their diplomas, and yet they graduated in 2019. The university in question says that this delay is due to the fact that students attained grades illegally and that the matter is now at the hands of the Rwanda Investigation Bureau.
According to the 599 students, by the end of September 2019, they had completed all the required courses and were waiting to receive the diploma in March 2020. We completed our courses in 2019, but to this day we are still unsure if we will graduate, because the only proof that we completed is our diploma. However, the school keeps telling us to wait. 2020 came and went, and we still have not graduated. When we ask them why we haven't graduated, all we hear is soon, soon. Then they set a date, and when the date comes, they tell us that there are some issues that need to be resolved before we can graduate. Just imagine you complete your courses in 2019, and 2022 is just around the corner, and we still have not graduated. That's another 3 years on top of our years in university. At home, they ask us if we went to university and where our diplomas are. They assume that we use the school fees for other activities. The students disclose that they're facing challenges in the job market without having the diploma. We often go looking for jobs, and they always request for proof that we completed school. And most of the times, that means you need to present your diploma. And now, because we do not have these papers, the process is usually really long. The university's administration says the COVID-19 pandemic has interrupted the university's plans to prepare for graduation for the students. When other universities opened last year, KIM remained closed due to financial issues that occurred. Onwards, things began to go downhill when the students did not receive their diplomas. And then in March 2021, RIB launched an investigation following allegations regarding some students paying for grades to qualify to graduate. Rachel Kaisenderwa, the owner of KIM University, confirms that the students will soon receive their diplomas, though not all, because some are still undergoing investigations. The investigations are still underway, meaning that some students are still being investigated because they allegedly acquired grades in an illegal manner. In that case, RIB will inform us as soon as the investigation is complete. For now, those who are eligible to receive their diplomas will receive them in due time. On the other hand, those who are still being investigated have to wait. As we speak, everything is in order. What we needed to file has been done and sent to RIB, and a report has been sent back. Now that the problem has been solved, we shall announce the date of graduation. The RIB spokesperson, Dr. Thierry Murangira, says that the investigation has revealed that 108 students changed their initial grades that were given to them by their lecturers. The investigation shows that the number of students that had their grades changed is quite high. This has affected both the students and those in charge of the MIS system. The investigation is still ongoing. We still need to find out who did it, how it was done, and what the motive was. The investigation shows that there are falsified documents. But like I said, the investigation is ongoing. If there was any bribing involved, we shall know. But so far, 108 students had their grades changed. According to the RIB spokesperson, he says that although the investigation is ongoing, it is evident that there was illegal activities that took place. When a student's grades are different from the ones that were given to them by the lecturer, it is clear that manipulation took place. Manipulation is against the laws and is very punishable. All we want to say is that the weight of these actions are severely punishable. Such offences are punishable under Article 276 of the Penal Code, where the accused can be sentenced between 5 to 7 years and fined. The KIM University suspended education in October last year due to financial constraints and is still looking for a potential customer to buy them. Gabi Muvunyi for RTV.
Now, two government ministries, the city of Kigali, as well as local and international NGOs, held commemoration activities on Friday to remember and honor victims of the 1994 genocide that was perpetrated against the Tutsi. The employees of the local and international NGOs gathered at the Kigali Genocide Memorial as part of their commemoration activities. Since last year, the NGOs have been holding their commemoration activities as one, and after visiting different parts of the memorial, contemplated on the role of the civil society on playing against in the fight against genocide ideologies. Government officials present also noted on the importance of holding commemoration activities in this way. Commemoration activities were also held by Kigali city authorities and employees. Officials and employees in the Ministries of Foreign Affairs and International Cooperation, as well as Trade and Industry, held commemoration activities to remember for the 26th time the 1994 genocide that was perpetrated against the Tutsi. Now, on Wednesday, the East African Community Headquarters in Arusha, Tanzania, commemorated the 27th anniversary of the genocide against the Tutsi. Gabi Mufunyi with the details.
The 27th commemoration of the genocide against the Tutsi took place at the East African Community Headquarters in Arusha, Tanzania. The ceremony was attended by senior members of the organization, including the organization's Secretary General, Dr. Peter Mathuki. He explained to the participants that during the 100 days of remembrance, various talks are organized aimed at fighting the negations and denial of the genocide perpetrated against the Tutsi, saying that, and I quote, "Over the course of 100 days, from April 7th to July 3rd, 1994, more than 1 million Tutsi were killed while the whole world was watching and did nothing to stop the genocide. Now, 27 years later, we remember the genocide against the Tutsi and the lives of the innocent that were lost. It is time for everyone to reaffirm the genocide will never happen again in Rwanda and elsewhere in the region as well as in the world." Dr. Peter Mathuki called on the participants to remember that everyone has a role in fighting against genocide ideologies. He called for cooperation in promotion of peaceful coexistence and solidarity in the East African region. The commemoration of the genocide against the Tutsi was organized by the Secretary General of the organization in collaboration with the Rwandan Embassy in Tanzania. Rwanda's ambassador to Tanzania, Major General Charles Karamba, stressed that those involved in the genocide against the Tutsi should be arrested and brought to justice wherever they hide in the world. Gabi Mufunyi for RTV.
Welcome back. My name is Ish Kevin and I'm your guest anchor today. Let's go to the international news. UN Secretary General Antonio Guterres was sworn on Friday for a second term as head of the world body, promising to draw on the lessons of the deadly COVID-19 pandemic. Okay, masku mudomo kashkuri momo plot du kwepa covid stomu majoro mpuzi zivoka of course ndashaki coffee mtoto uri soho haryo uri sosa ma player babe I'm sorry ndakwereka isoko nkugurira inkoko surahita umbwira uri honi hold up nubwo ntaroga ndakoma ngonga nk'inzoga ya vodka ndi soba nkora ibinyonga makoka alhamdulillah ndakora nkasora amakosi yose nakoze yantoje kugabanya love na losses amarozi yose naguze abatoto mbakaraga kope ya lompe kuri kushe na bouteille ubufoni rasona Nicole ya bose ngo kiri gute twabukinze flight ya 4 p.m. I catch flights not feelings when we catch up not kidding ni wafati Kigali na CV dore batwumva mbale nta CV pow
Absolutely.
na CDs pow.
Well, thank you very much, Ish Kevin, for making time to be with us. And of course, we're still in a pandemic. Maybe to your fans, what would you tell them about COVID today?
What I can tell my fans, please protect yourselves, wear your masks, and make sure you wash your hands. Anytime that you're coming home or you live in your home, make sure you wash your hands, keep your sanitizer with you wherever you're going, and God protect you.
Absolutely.
Much love to you.
Well, thank you very much, Ish Kevin, for making time to be with us.
I appreciate it. Thank you for having me.
Well, thank you very much, our viewers, for making time to be with us. And as usual, every Friday, we have our guest anchor segment. Keep sending who you want to see on this segment. God bless, keep safe. And do remember, we're still in a pandemic. Play your role right as we end this pandemic together. God bless.